Hello, I'm Dr. Joya Schoen. I go by Joya, and I'm going to talk with you today a little bit about a symptom and complaint that is very common in the people who come to see me, and that is fatigue. You know, just the sound of the word makes me feel tired. It is very prevalent in our society. I have found several things that are frequently the cause of fatigue, and I wanted to tell you about them. Many people come who have looked and looked for a doctor who would give them thyroid. They thought that they needed it for years. They've read of the symptoms, and they have got most of them. So they've read somewhere on my website online that I'm a good thyroid doctor. I did not post that, but patients did. And it's because I think outside the box just a bit. So I test my tired patients for their thyroid function, not just the pituitary function, which is the TSH test. I think it's important to test the free T4 and the free T3 and to see whether the person has thyroid antibodies. Most of them have never been tested for that. Many people with normal thyroid tests are absolutely well served by a small dose of thyroid. This is not standard medical advice, but it is my advice, and my intention is to help and never to harm, so I do not give too much thyroid or give thyroid that's inappropriate. But it's important to not just look at the blood test, but to look at my patient's symptoms. They've looked at them and they've lived with them, and it's important to listen to those. And many people have, half a dozen or more of the well-known signs and symptoms of hypothyroidism. Nobody has simply bothered to look at the patient. They look at the test and said, "You're fine." And the patient came in to tell us they weren't fine. So I listen. That's what makes me a good thyroid doctor, basically. So upon finding thyroid out of balance, we bring that into balance. It may be all some people need, that one thing. But I always remember what I have learned, which is that when you bring up the metabolic rate with thyroid, you're asking all the organs to work a little bit harder, because thyroid hormone tells the cells to metabolize, to make energy and heat from the food we eat. That includes the adrenal glands. The adrenals are often also out of balance or somewhat tired. And if we tell a tired organ, work harder, it can just rebel, and it can cause symptoms that were not necessary. So I consider both the thyroid and the adrenal at the same time. And we test the adrenals in several different ways with a test called the adrenal stress index, a saliva test which collects 4 samples over one day. Cortisol is what we're measuring with that. Whether it's too high or whether it's too low has a lot to do with how long this person has been stressed and how much they've been stressed. So we find all kinds of levels. If it's been too high, we advise stress reduction and give supplements that help to normalize the levels. If it's too low, which is frequently the case in adrenal fatigue, then it's necessary to support the adrenal glands to make their hormones more easily and be happier. The things that feed into the adrenal fatigue is often low blood sugar. If a person does not eat often enough or well enough, the brain does not get the glucose that it needs to function on, and it's very sensitive. And when glucose drops a certain amount, an alarm goes out into the body. You don't hear it with your ears, but the alarm goes to the adrenals saying, "Get sugar." The brain is demanding it. What will happen then is the adrenals will obey, make cortisol, which goes to the liver, and the liver will release stored glucose. It's stored as glycogen. And the glucose goes into the bloodstream and the brain's happy again. Some people whose adrenals are too tired to do this know that they almost faint, or they become fuzzy in their thinking and unable to concentrate when they've forgotten to eat. I have people who know that. Sometimes they learn their lesson and eat more often, and many times it's just a single happening. But when it's happening every day, or fatigue is so great that there's no life anymore, then people learn. And it's a really important learning to do. If any of this pertains to you, feel free to call our office today and make an appointment. We'll be glad to help you.